We are a very visual society, and so much of what we do depends on being able to see, recognizing faces of loved ones, being able to read, being able to drive, which is so much of our independence. People are really afraid of losing that. It strikes at something that is very essentially human.
Some of the most basic interventions we now use for eye disease exist because of research that was supported by the National Eye Institute.
At the time the Eye Institute was founded, the major diseases that caused vision loss were glaucoma and cataracts, age-related macular degeneration, or AMD, and diabetic retinopathy. Among these, only cataract could actually be treated. Now, the big four conditions all have remarkable treatments.
I think the major thing is vision is incredibly important. When you have problems with it, the consequences are catastrophic. The only way you're going to deal with these are by doing basic research.
Without the basic research, there ultimately can be few, if any, clinical trials and treatments and cures.
One of the major successes for vision research is the story of anti-VEGF treatment for vascular diseases that affect the retina. These include diabetic retinopathy and age-related macular degeneration.
Back in the 40s, Michelson and others had realized there was this factor X that somehow was coming out of the retina that led to abnormal blood vessels growing. People searched for factor X for decades. Judah Folkman had come up with the idea that blood vessel growth drove cancer. So the ophthalmology group were trying to apply the basic principles that have been developed in cancer to issues in eye diseases. Well, in the late 80s and early 90s, researchers had identified a protein that did interesting things. This factor, when you introduced it, would cause all kinds of leakage and swelling, and that was clearly of interest to the eye people. So a group of us really set to work to see whether this VEGF or VEGF could be factor X. We were able to show the amount of VEGF really correlated with the severity of abnormal blood vessels. Also, if you injected VEGF into normal eyes, you'd get abnormal blood vessels. So that was really exciting. We thought, wow, we may have found factor X, hard as that is to believe. Maybe there is one factor that is such an important driver of abnormal blood vessels in these different diseases. And we were really ready to go to patients, seeking to see whether we could come up with a drug that would work to block VEGF and be useful in eye disease. And we're able to show these anti-VEGF drugs were effective. When it actually proved to be effective in patients in the large clinical trials, it's one of the most exciting things that's ever happened to me in my professional life.
Anti-VEGF drugs have led to tremendous improvements for patient care. This treatment rescues the vision. It improves their quality of life, and it substantially reduces the economic burden on the healthcare system.
It was tremendously exciting to be present through the early stages, going from the questions and looking after patients without great treatments, and then doing the studies where you start to see these tantalizing changes and then actually come up with a treatment that is used in 1 million patients around the world every year. It's just hard to comprehend. We still pinch ourselves, I think, with that one.
There's a huge urgency for treatment of eye disease. And, I feel like we can't work fast enough or hard enough.
What do I want to tell the patients? I want to tell them that we are working hard to get to a treatment for them. What we're doing is not magic. It's a very careful, very thought-through process, and we go through it very rigorously to make sure that it's going to work, and we'll get there.
Nature does not give up her secrets easily. And each time you find a little bit of the truth, each time you pull back the veil just a little bit, it's a wonderful feeling. We need steady, thoughtful support for eye research, and that can come only from the National Eye Institute.